Hello everyone, my name is Louise GARCIA. I am a physical therapist and a faculty from the College of Rehabilitation Sciences. Now this time, what I'm going to show you are the different physical therapy tools that we use for intervention. So before we get started, let me just clarify that these are just the tools that I'm going to show you are just some of the modalities or adjunct treatment that we provide to our patients. But you have to remember that the number one or the main intervention or management that we provide to our patient are exercises. So we have different forms of exercises such as range of motion exercises, stretching exercises, resistance exercises, balance exercises, and other postural exercises. So those are ton of exercises. Now for this one, these are some of the physical agents and modalities that we use either prior or meaning preparation for the patient before performing the exercises or in conjunction while performing the exercises. Alright? So let's get started. Alright, so since I have mentioned that we perform resistance exercises, so we can actually perform resistance or strengthening exercises just using our body weight, no? But as an adjunct or as a tool for that one, we also have our dumbbells, alright? So these are 3-pound dumbbells, and I also have here exercise bands. Alright, so these are some of the tools that we use to add additional resistance or intensity for the exercises so that we can achieve an improvement or a progress in the strength needed by the patient. So exercise bands, dumbbells, we also have ankle weights that we place on the lower extremity when performing exercises. Alright? So next, as physical therapists, we also provide electrotherapy for our patients. So meaning we use current, no, in providing intervention to our patients. So I have here a case, okay, that contains my electrical stimulation machine. Alright, so what we do is we attach different electrodes to the specific affected area of the patient, and this machine would conduct electricity to facilitate either muscle contraction or to provide temporary pain relief for the patient. Alright, so this is the electrotherapy machine. Okay, we also have hydrotherapy, or we use the water or thermal agents in providing management for our patients. So I have here an alternative mode of heating pad for my patients. Okay, so I actually bring this during home therapy for my patient, no? But for the real hot moist pack, we have different sizes that would fit the regions of the body. But what we do with this is, of course, this is a heating pad. So once this is already heated, you can apply a little covering for it, and then we apply it to the specific joint area of the patient that has a chronic pain. Okay? Again, I have to clarify that if it's an acute pain, then we use the cold modality, or for basics, it's ice, no? But if it's already a chronic condition, then we provide the heating modality. So one example is the heating pad. Okay? Lastly, what I have here are some of the orthoproste or orthotics and prosthetic tools that we use. Okay? Basically, these are just bandage and tapes. Okay? What I have here are tapes, no? So first, let's go with bandage. So bandaging, we use this to stabilize a specific joint if there are, for example, ankle sprain and you want to prevent it from further injury, so you want to stabilize the joint, so we can use the bandages. Now, on the other hand, for sports PTs, no, or for athletes that they want to continuously play but we have to keep their joints stabilized. So we use this tape. Okay, so it is a more rigid tape. So meaning it's not flexible. So we call this, as the brand, it's Mueller tape, no? Pero generally, it's called the rigid tape, okay? Because it is not flexible. So it is used to stabilize a specific joint. Now, on the other hand, if you want to facilitate movement but prevent pain or excessive motion or movement, or you want to help the movement, no? So you can use the elastic tape. We generally call this elastic tape, but for brand, we call it KINESIO tape, or the one I have here for the LaSalle tape is a rock tape. Okay, so that's the brand. Okay, it is commonly seen on athletes, but of course we use it on different types of patients. So it's not just specific for athletes, no? Because we can apply it for different types of patient. So of course, these are just some of the modalities or tools that we use for physical therapy. But then again, the main interventions that we provide are exercises. So that's the main bulk of our intervention. So we use this in conjunction with the exercises. Alright? So that's it, and thank you.